Hello, I'm Rajiv Tandon again, and I'd like to share the results of a survey that we conducted with regards to patients' experience of side effects and its impact on their functioning and on aspects of their life that they considered important. So, in terms of the survey, uh, it was a web-based 20-minute to 30-minute patient-reported survey, uh, and it was administered to individuals with a diagnosis of schizophrenia. The objective was to gain some information, garner information about the frequency of side effects, the impact of side effects on patients' lives, on different aspects of patients' functioning, and the extent to which the patients felt that different side effects were interfering with or impacting different aspects of their function. And then what their emotional reactions to these side effects and their impact on their functions were. Patients, there were 435 individuals with schizophrenia that were from 7 different countries across the world, 4 in Europe, 3 outside of Europe, 18 to 65 years old, most of whom had received a diagnosis of schizophrenia within the past 5 years. And since the purpose of the study was to evaluate the impact of side effects associated with antipsychotic treatment, it was important that patients had been on that stable antipsychotic regimen for a certain period of time. And in this study, they had to be on that particular stable dose of an antipsychotic for at least a month. On average, it was about 8 months, 1 to 12 months. And we obtained information on side effects, on treatment satisfaction of individuals, the extent to which they were happy or dissatisfied with treatment. We obtained information on side effects utilizing the Glasgow Antipsychotic Side Effects Scale, and we developed a special questionnaire to evaluate the impact of these side effects on different aspects of their functioning. We assessed functioning via the QLSQ, the short form questionnaire. So in terms of data, 435 participants, there were 307 from countries outside of Europe and 128 from countries in Europe. Now, the education and employment levels were a little higher relative to the general averages reported for the population of schizophrenia in the world. And the principal reason for that probably had to do with the methodology, the internet web-based survey method that was utilized. More than half the patients had been diagnosed as and receiving treatment for less than 5 years. And as I mentioned earlier, all patients had been on that stable dose of that particular antipsychotic, whatever it is that they were on, for at least a month, an average of about 7 months. The majority of patients reported that they were just a little satisfied or somewhat satisfied, in the middle of the range in terms of satisfaction with treatment. Not completely dissatisfied, not completely satisfied. About 2/3 of the patients reported that they were little satisfied or somewhat satisfied with their treatment. So as one thinks about the side effects now, there were a whole range of side effects, and the frequency of side effects was gauged in terms of, did they experience these side effects every day, a few times a week, just once, or they had never experienced their side effects. And as you can see, there were a whole range of side effects that were reported. And so as one thinks about the groupings of side effects that are relevant to an effective evaluation of function, there were a whole number of sedating side effects, such as sleepy during the day, feeling drugged or like a zombie, slower movements. There were also a whole range of activating side effects such as difficulty sleeping, muscles have been tense or jerky, legs have felt restless, I can't sit still, hands or arms have been shaky. So the grouping of side effects that we discussed earlier with regards to activating, sedating, and a whole range of other side effects is relevant to understanding the impact of different side effects with reference to function. And so as one thinks about the impact of these side effects on functioning and the emotional experience of patients as they experience the side effects and their impact on function, what one sees is, again, a whole range of activating side effects, a whole range of sedating side effects, which were very prominent and actually appear to have the most significant impact on the patient's functioning. The activating side effects, sedating side effects, and also to a somewhat lesser extent, but significant, metabolic and endocrine side effects, particularly related to problems enjoying sex, were somewhat less frequent, but were also associated with significant adverse impact on the patient's functioning and their ability to lead the kind of meaningful, productive lives that they wanted to. Now, the impact of these side effects on functioning was fairly serious. The severity of the impact was assessed using a visual analog scale going from 0 to 100, and the impact of these individual side effects on functioning on this particular visual analog scale ranged from 50 to 70, suggesting a fairly significant impact of these side effects on those aspects of function. Now, when patients were asked to describe, well, how do these side effects and their impact on your function make you feel? The most commonly reported feelings were, I'm frustrated, I'm dissatisfied, I'm angry, I'm irritated, I'm impatient, I feel ashamed, I'm embarrassed. So significant emotional impact of these side effects and the impact of these side effects on functioning. And so if one looked at the association, statistical association between different groups of side effects and function, one found a low to medium negative correlation with different aspects of quality of life, suggesting that the more severe the side effects, the worse the quality of life of individuals experiencing those side effects. So the critical take-home point that I would like to emphasize is side effects of medications certainly are associated with significant safety considerations. They're also uncomfortable for patients, and that can impact adherence. But one of the frequently overlooked effects of these side effects, consequence of these side effects, is that they impact actual patient functioning and adversely affect the individual's ability to lead lives of maximal meaning and productivity. And that is something that patients recognize, and it significantly impacts not just their ability to understand the benefits of treatment, but it impacts their life. It adversely impacts recovery. Thank you all for your attention.